Hello, Washington chiropractors. As you've undoubtedly heard, Washington's COVID state of emergency ends today, October 31st. So what does this mean for you as a healthcare provider? For starters, nearly all of the COVID-related restrictions are being lifted. Although the various health and safety measures we've been directed to follow these past few years are still recommended, they are no longer mandated. No more social distancing, no more requirement to be vaccinated and/or maintain vaccination or exemption documentation, and no limitations on how many people you can have in your clinic at any given time. However, if you have an active mask or vaccine complaint with the CQAC, maintain your records until any open complaint is resolved. There are, however, some requirements that remain in effect. Contrary to what many DCs have heard from patients, news outlets, and community discussion groups, the mask mandate for healthcare settings is still in effect. This is because it is part of the Secretary of Health's Order 20-03.10, which exists independent of any gubernatorial proclamation. As a licensed healthcare provider, you are required to follow the directives of the Secretary of Health, and Dr. Shah has ordered that masks continue to be used in all healthcare settings, as well as long-term care and correctional facilities, subject to the same limited exceptions we have observed since the order was originally issued. The WSCA has partnered with other healthcare associations, and we have asked DOH to review the order in light of newly adopted CDC guidelines allowing for a tiered approach to masking in certain healthcare settings. DOH officials have indicated to our lobbyist, Lori Grassi, that this order is under review and more guidance will be given in a few weeks. Although they have not indicated exactly what that guidance will be, we have requested it to be more closely aligned with the current CDC guidelines, which recommend masking in hospitals and urgent care facilities, but not in private clinics. We are aware that this continues to be a point of contention, both for clinic staff and for patients, but the order is still in effect, and it is enforceable. It does not matter what other provider types are doing or not doing in their clinics. All provider types are subject to this order. Chiropractors are advised to follow it to the letter. The end of the mask mandate is not here yet, but it is in sight. We will provide more details as soon as we have them. Lastly, the CQAC's Clean and Screen Directive is still in place. This may change soon, but not until the Commission meets and addresses it. Many have asked if they are required to take the patient's temperatures under this order. The answer is no. The Clean and Screen Directive requires you to screen for fever, which can take the form of asking the patient if they feel feverish. Obviously, an actual measurement is preferable, but the more simple inquiry will suffice. This is an evolving issue, and the WSCA expects more updates soon, so be sure to watch your emails and newsletters for more information. As soon as we have it, we will share it with the profession. Even as the pandemic phase ends and we transition into living with COVID, the WSCA will be here providing guidance and interpretation, helping chiropractors help patients.